You for that report. Well, it doesn't matter if you're rich or poor, everyone gets help at this clinic.
We do our work because we're passionate about it, because we want to help people and we want to provide the quality work.
How this eye-opening program is helping those in need. Thanks to new developments in eye care, more diseases that affect our vision are treatable and preventable. But for those who cannot afford health care, vision problems are more difficult to cope with. To fill the gap in the Middle East and North Africa, a company is helping thousands of people with impaired vision finally see what they have been missing. Susan Baumel from IFC TV has more.
Since the dawn of civilization, Egypt has been at the center of innovation in both medicine and trade. Now a unique business model is being developed here, one that is bringing eye care services to people of all income levels and helping the blind to see.
This is a business model for the future, social entrepreneurship or compassionate capitalism.
9-year-old Nagam is one of thousands of patients benefiting from the services at the Magrabi Hospitals and centers in Cairo.
The teachers and her parents noticed that she cannot read letters on the blackboard, she cannot follow the teachers.
Although many patients at this facility pay standard prices for high-quality eye care, Nagam is receiving the same level of care in a jointly staffed clinic next door. Here, those who cannot afford to pay the full amount are treated at lower or no cost.
During our screening, we found that she is complaining of developmental cataract in both eyes. Cataract is one of the most common eye diseases and preventable eye diseases.
Surgery was performed with life-changing results. The doctors who diagnosed her condition are part of a medical team that Magrabi sends out in a caravan traveling into the remote areas of the country and diagnosing those in need of eye care at no cost. Abdul Maboud is a farmer in his 70s who received cataract surgery. He explains through an interpreter how it improved his socio-economic situation.
Since he have this problem, he can't see well, he can't work well. After he fixes his eye, he can do his work well and live in a good way.
Amin al-Magrabi, a member of the board of directors, is building on the work of his father and grandfather, both ophthalmologists and surgeons who founded the hospitals. He says the hospital's business model is growing to include as many people as possible from every level of society.
We service everyone, but the people that can't pay won't pay, and the people that can pay on a tiered basis.
IFC, a member of the World Bank Group, has partnered with Saudi Arabia's Magrabi Hospitals and centers to expand world-class patient care and ophthalmology services to underdeveloped markets throughout the Middle East and North Africa region. Magrabi's managing director, Mutassim Ali Reza, explains why their work in the healthcare sector succeeds as more than a profit-making enterprise.
We do our work because we're passionate about it, because we want to help people and we want to provide the quality work, and money comes along with that as opposed to money being our first priority. And I believe that's also IFC's vision and mission.
IFC's investment in private sector health care in developing countries is increasing access to services for people of all income levels.
Private sector is increasingly occupying a big space in the healthcare system all over the world, whether in developed or in developing countries.
The success of Magrabi's humanitarian business model may eventually be judged by its profitability, while for others and an increasing number of people in Egypt and the region, it provides a path to a brighter economic future. IFC TV, I'm Susan Baumel for CNN World View.